Hello everyone. Today we are learning Vacutainer and its uses. Vacutainer tubes are the closed system of blood collection in the laboratory. It is important that constituent remains unchanged after the withdrawal of the blood or body fluid of the patient to obtain the valid medical laboratory results. Some factors like platelet and coagulation factors are activated when the blood vessels are punctured. The clotting will continue in vitro if sample container do not contain anticoagulant. Let's learn some definitions. First is whole blood. It is a venous, arterial or capillary blood in which the concentration and the properties of the cellular and extracellular constituents remains relatively unaltered when compared with in vivo state. Second is plasma. The cell-free supernatant of the blood containing anticoagulant obtained after the centrifugation. Third is serum. It is undiluted extracellular portion of blood after the adequate coagulation is complete. In short, when the blood is clotted, the resultant supernatant is serum, and when the blood is anticoagulated, then resultant supernatant is plasma. What are the anticoagulants? They are additives that inhibit the clotting of blood by different mechanisms. They are EDTA, citrate, heparin, oxalate with fluoride. Let's learn EDTA. The full form is ethylene diamine tetraacetic acid. Salts available are dipotassium, tripotassium, and disodium. Concentration of the EDTA is 1.2 to 2 mg per ml. Color of the vacuite is lavender and purple top. In K2 EDTA, anticoagulant solution is dried in the interior surface of tubes, and in K3 EDTA the solution comes as a liquid in the tube. It is used in hematology procedures like CBC, blood group flow cytometry. It is binding with calcium ion, so the calcium ion is not available for the coagulation process and thus anticoagulation is generated. Second is a citrate vacuite. It is containing 3.2% citric acid. The salts available are trisodium citrate. A mixture of 1 part citrate with 9 part of blood is recommended for coagulation test, and 1 part citrate mixed with a 4 part of blood is recommended for the determining the erythrocyte sedimentation rate. For coagulation test, the color of the vacuity is light blue top, and for ESR determination the color is black top. It is also binding with the calcium ion and thus producing anticoagulation. Third is heparin. 12 to 30 international unit per ml of the unfractioned sodium, lithium or ammonium salt of the heparin is available in the heparin vacuity. The color is a green top. It is acting by inhibiting the thrombin activity, and it is used in emergency biochemistry and cytogenetics. Fourth is sodium fluoride. In sodium fluoride, potassium oxalate is available as an anticoagulant and sodium fluoride is available as a preservative. It is used in the blood glucose estimation because it inhibits glycolysis. The color of the vacuity is a gray top. Tubes without anticoagulant is a plain clot activated tube and serum separator gel tube. The serum is separated after clotting of the blood in the tube. Plain tube. There is no additive in the tube. It allows clotting of blood. The serum is separated after clotting. It is used in biochemical, immunological, serological and PCR tests. Clot activated tube. It is same as a plain tube, but it contains clot activator. Clot activator is added to accelerate clotting. Clot activator may be glass, silica or kaolin, etc. Serum separator tube. It contains gel and clot activator. So when blood filled tube is centrifugated, then the serum part and the RBC part is separated by the gel. It works as a barrier. It is used in biochemical, immunological, serological and drug level tests. Order of draw. What is it? When technician is required to collect multiple collection tube at the same time, then the order of draw must be followed to ensure the proper collection of blood. If one randomly collects the multiple tube, it will increase the chances of contamination of anticoagulant to other tubes and may alter the constituent of the vacuity. First, culture tube is collected to minimize chances of external contamination. After that, citrate tube is collected to ensure platelet and coagulation factors are minimally affected at this time of collection. After that, serum separator gel tube, plain tubes are collected. Then plasma separator, heparin tube, EDTA tube, fluoride tube in this order is collected. These are the references for this video. Hope you like it. Thank you.